these young physicians, they've gone so soft. They need a chief wellness officer to make sure they're well. Wait a second. Wait. Does my practice need one of these? Could I be the person? Stay tuned and find out how you can. Hey, this is Brad Block, host of The Physician's Guide to Doctoring. This is a personal and professional development podcast for physicians where we have experts on the show that try to teach us everything we should have been learning while we were memorizing Krebs cycle. Welcome back to the podcast. On today's show, we have Dr. Jennifer Shaer. She is a board-certified pediatrician and international board-certified lactation consultant, a certified executive and life coach, and the chief wellness officer at Allied Physicians Group, one of my favorite pediatric groups because it's where I bring my kids and they refer me a lot of patients. So we love them there at Allied Physicians Group. In addition to general pediatrics, she has a special interest in breastfeeding medicine and in empowering parents and patients to maximize their behavioral and emotional health and well-being. And she is also the host, and you definitely need to check this out, of the Reinventing the White Coat podcast, which is available on Spotify. So, Dr. Shaer, thank you so much for being on the show.
Oh, thanks so much. Please call me Jen, Brad, Jen.
All right.
It's really a pleasure to be here. Thanks for having me.
Well, thank you. Thank you for all that you do for physician wellness, because that's what we're going to be talking about today. So first, let's start off. What is a chief wellness officer?
Good question, right? I'd say you ask 10 chief wellness officers, you'll probably get 10 different answers. It's sort of a new invention in my neck of the woods where I practice. I am charged with trying to ensure the well-being of all of our clinicians so that when everybody is at their best, they do their best and everybody wins. The company, the doctors, and the patients.
I guess it's kind of like positive psychology, but for a business, right? Like psychology has always been the study of what's wrong with people and how to make that better. And positive psychology, and we've had Jordan Feingold on the show a bunch of times where she's talked about that. It's taking someone who's doing well and find out how to get them to do even better. So it sounds like that's what wellness is for a business. What are we doing well and how can we do that maybe better?
Yeah, and I love positive psychology, Martin Seligman, all that stuff. I'm a deep reader of all of that stuff. But for a healthcare company, it's beyond that. It's systems that are creating some of the unwellness. It's not just about trying to have the individual build resilience and do a wellness class and change their mindset. It's how do we make the workplace more easier to function? Not shaming the people, because doctors are the hardest working people on the planet. If you give them the right environment, they're going to do the job.
So a practice like yours, right, where it's physician owned and physician run, like why would a practice need a chief wellness officer? Because I would think that the people that you have in the C-suite are physicians who are seeing patients. So if the decisions that they would be making would have the practicing physician in mind, I would think a chief wellness officer would more be like a place that's run by hospital administrators. And now you need the physician perspective to be taken into account in order to serve as maybe a foil. But if it's owned and run by physicians, clinicians, then what role does the chief wellness officer play? I mean, clearly something, because this is what you do.
Yeah, well, I would say two things to that. First of all, we are not completely physician run. We have executives. We have a dyad model where we have a business type executive with a physician dyad. So we make decisions together. So I'm dyad with our chief operations officer, who's not a physician. But you're right. If it was just a practice and it's all doctors, you'd think you wouldn't need it. But think about how we are. We are sometimes our own worst enemies. And, how we have been trained in our mindset to just burn that candle at both ends and go, 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 go. And how many of your partners haven't taken a vacation? And then what we expect, it's I walked uphill both ways in the snow.
In the snow.
Right?
Yep.
We expect the younger generation to work as hard as we did. And so there is a role for it in all capacities, I believe.
Can you give us an example of where maybe you've had to push back on a policy where like this was going to be instituted and it really passed by all the other physicians. And you're like, wait a second, folks, this is not, let's reconsider this.
Yeah. Well, I mean, any time that you're looking at the bottom line revenue, that you either have to bring in more money or cut costs.
Yeah.
The sort of knee-jerk reaction to bring in more money is, okay, just see more patients, right?
Yeah.
And so to that, I say, okay, if you want to see more patients, how are we gonna bring in support staff? How are we gonna make the doctor more effective?
Yeah.
So, we started to test things. Not everything works, right? But it's that constant give and take. We did a scribe trial with scribes, things like that. Look, it's challenging. I'm not going to say we have it all figured out, but we do have the commitment to try to always be moving in the right direction.
I'm going to take this opportunity to plug one of our sponsors. Heidi Health is an ambient AI algorithm. So like this is coming hopefully soon, that we're going to be able to really integrate this into our practice and into our EMRs, so that we have like the scribes now become, sorry, scribes, it obviates the need for scribes because it just listens and writes your notes and hopefully sends out the orders and sends the medications that you're also dictating.
Yeah,
so
I do. I really believe that stuff will be
fingers
coming
crossed.
at some point. I hope most of us can wait long enough to get
Yeah.
there.
So if you were creating a position de novo, and tell me if you did that, where do you begin? So if you have a listener who's like, wait, my practice needs this, we need this.
Yeah.
Where do you begin?
So I did actually create this de novo for our company, and I'll tell you why I did that. But if you're thinking about wanting to do this, I guess the question is, what's your goal? Always look at what your goal is. And so for me, I was functioning in the role as chief medical officer, and I found myself frequently being called in, not just for, how are we going to handle COVID and all the different things related to things for the company, but I was frequently called in to have conversations with physicians who were misbehaving or not signing their charts or things like that, things that needed to be dealt with. But I found myself always coming at it from, well, why?
Yes. Yeah.
This doctor doesn't want 8,000 charts and to be up at night. Like, where's the problem? Where's the compassion? Where's the preventive part of this? And as a pediatrician, especially, we're all about prevention. And while I totally understand the need to deal with the problems once they arise, I felt that we were missing the boat completely. So I just sort of pitched the idea. I did all the research. There's so much data out there. If you needed to put together a proposal for your administrators showing the cost savings of, retaining one physician.
It's interesting. I did an interview a while ago with another pediatrician. His name's William Cooper out of Vanderbilt, and he has this system at Vanderbilt where you get a certain number of complaints, unsolicited complaints from a patient, right?
Mm-hmm.
If you're an outlier in terms of the number of complaints, then what they do is they sit down with you and, have like a non-judgmental conversation. What are things? And what they find is sometimes, as you said, it's a systems issue. It's like the physician's in a terrible mood and having terrible interactions, not because they're some terrible person, but because they're like, their shift starts at 7 a.m. and they have to get the kids on the bus and the kids are always like, give that person extra half an hour and suddenly all those complaints evaporate, right? So like often there are systems, as you're saying, systems problems that we can work on to work with our physicians instead of trying to get them to be the square peg that fits in the round hole.
Right. But for me, it's a yes and. Brad, if you have a bad day at work and you come home and you yell at your wife, I don't care how bad your day of work is, it's not okay to yell at your wife. Like,
yes.
Let's fix what's going on, but also let's behave.
Yes. Right. I think it was more happening in the office, but nonetheless, you shouldn't be yelling at anybody. You shouldn't be yelling at the staff. You shouldn't be right.
Right.
Yes. How do you think the challenges are different for you in like an outpatient private practice versus a hospital-based system or an employer-based system, right? As opposed to a practice owner, you're employed. Like, what are the challenges that you have versus someone in a different situation?
Right. I mean, every setting has its own set of challenges. The healthcare systems, most physicians who work at the healthcare systems, I think, are a little bit less empowered. They have that sense that they're cogs in the wheels. And I think when you're working for a practice where you have ownership, it's different stressors. It's, how am I making payroll and, those types of issues.
You have more skin in the game. You have more skin in the game. You're not worried. Yeah. You just have to, when you're an employee, you show up to work, you do the work, you go home, and you don't care how the system runs as long as you're doing it. You're not empowered. You don't have that skin in that game. So it's like a different, I can see that.
And people have different preferences. I mean, some people just really want to
Clock in, clock out.
clock in, clock out,
Yep.
and some really want to navigate the ship. It's really what makes you tick.
But for a chief wellness officer at one of these institutions, like how would that differ from their role in your institution?
Yeah. The issues that come up relate to whatever is on the minds or the functioning of the people within the system, right? So I always will point out that the company really is just the people. Wherever those issues are is where we put our attention. So if I am working with, it's a lot of coaching and helping people sort of figure out where their issues are, or looking at individual levels and on the system level. So if I'm in a hospital, it's probably going to be about meetings and policies, and is there too much red tape, or, things like that. And if I'm at a practice, I'm probably talking to local division people on workflow and the mindset around, dealing with angry patients or running behind schedule, things like that.
In terms of moving the needle on wellness, it's a lot of times it's the culture of the practice, right? And so the culture is only as good as the effort that the physicians are willing to put into it. How do you get buy-in? How do you get buy-in from physicians, especially ones that, let's say you're surrounded by a bunch of curmudgeons who are like, this is just another day at the workplace. And that attitude's infectious. How do you steer that ship?
Yeah, look, emotions are absolutely contagious, right? The curmudgeon and the grumpy and the whining and the complaining. It really starts with the leadership, local leadership. Wellness and culture, it cannot be top down. It really needs to be bottom up. And you are 100% right. I always say there's this pressure as the chief wellness officer that somehow I'm responsible for culture. I can't control the culture. All I can do is nurture it and help people. Look, I always say that when you have somebody who's truly a toxic person, that you're better off getting rid of them, because that is just poison to the culture. But for people who are just sort of grumpy and like to complain, pointing at like the impact that they're having around to people around them. For me, and I don't know about you, Brad, we all get into grumpy moods. And when I'm in a grumpy mood and somebody will point it out to me, right, I will remind myself and try to point out to other people that we're actually here. This is not, people sometimes feel trapped, right? Oh, I have to be here. This is a choice.
I mean, you got bills, you got to pay those bills somehow.
That is a choice, right? Yep. So I will say to you that, if you're at work and all of a sudden some emergency comes up at home, you're going to drop everything and leave.
Yeah.
Okay? So if you're choosing to go to work because you need to pay your bills, then own that choice. Okay? I am choosing this job because I am able to support my family. I want to get my son through college, and I'm going to make the best of it while I'm here. So like I could leave. I could go sell drugs. I could do, there's like anything you really have a choice.
Legally or otherwise. Yeah.
There are things that you could do. And so I just try to have a little bit, because otherwise you become such a victim. When you get stuck in that victim mindset, it just becomes this like downward spiral into such negativity. And
so have you had success in turning those curmudgeons around? Like taking someone who's being so negative all the time and showing them a mirror and being like, this is what you're doing to other people. Like, could you just lighten up a little? I mean, does that work?
Yeah. So you can't say to somebody, just relax, right?
Lighten
just
up. Yeah.
Relax. That just like makes everything worse. But so there's two approaches. People who are curmudgeon-y and they are actually being, from an HR perspective, inappropriate to the people around them. They get disciplinary. That's not wellness, right? But people who are
like Eeyore.
What's that?
Eeyore. You work with Eeyore, right?
Okay,
and so they come in
Eeyore. You have a conversation with Eeyore. Eeyore is good at heart, right? Eeyore doesn't realize that he's dragging the room down. Okay. So yes, those are the types of conversations. That might be Eeyore's go-to state.
Yeah.
But he could turn it on if he had a conversation with somebody and just say, look, point out the impact it's having on those around you. What can we do to help you just put on your game face?
Yeah. Okay. Okay. I'll give it a try. And this kind of dovetails with that Eeyore, because I want to ask you about learned helplessness. Like, and this might work more in a setting of an employed physician,
Mhm.
but this idea that the system can't be changed, I can't be changed, that's, I feel like something that's ingrained in us as physicians. Like, this is how we've always done it. This is why we do it this way. This is how rounds work, because this is how rounds worked for me, not because I have a reasonable explanation for it. This is the system. So how do we help people work against that learned helplessness?
So it's a multi-layered sort of question, I think. And
Okay.
I'll say that there's
Tease
a
it.
couple of areas that we can touch on with that. One is that if you're trying to sort of move the needle, not on just one individual person, but on the mood and the culture in general
Yeah.
of that sort of sense of this place, it's just always this way, it's always this way, you only need to impact. If you can change and you can engage 10% of the people in the workplace, you'll have a tangible and a really noticeable change. And just like the negative stuff spreads, so does the positive. So, there's research that shows how, 10% of your employees are going to be actively engaged and 10% are going to be actively disengaged. And the rest are just sort of bystanders,
Yeah.
and they'll flow with the others.
With the dominant 10%. So try to make the engaged one the
Yeah.
dominant one rather than allow the non-dominant ones to, or
Right.
not
And
the
by
disengaged ones to bring
Yeah.
everything down.
And by focusing on what you want more of instead of what you want less of, it really helps. So
It's funny. I tell people the same about eating. Focus on eating more of what you like to eat that you can eat with impunity rather than stop eating the things that you.
Exactly.
Yeah. So I love that. I love how that works.
Exactly. So you take your hotspot people and you give them the, attention, the praise, and you empower them to then trickle down some of that behavior to others. And then the grumpy people just become sort of less relevant.
Rising tide. And I love that this is coming from a pediatrician, because this is such a child rearing thing to say, praise the positive, just try to ignore the negative.
Right. I want to make a point about pointing out true burnout. There's a difference. Sometimes people are like flat out depressed and really need help. And this is not, that's a whole other.
Yeah. I mean, the two can overlap. There's a Venn diagram there, but there's burnout, which has this very specific definition by Maslach. Don't quiz me on it, but
Stina Maslach, yes.
Yeah. I think depersonalization,
right,
lack of fulfillment, and there's one more thing.
Now you're challenging me and I'm drawing a blank. The depersonalization. It'll come to me as we're talking, but
those are the symptoms of burnout, whereas depression is different. Oh, feeling like you're a cog in a wheel. I think that was the last one.
But that, that word, when we talk about wellness, I mean, that's sort of picking up on those people and really trying to get them sort of the emergency support that they need and the real intense support. Yeah. That's kind of one little piece of this. Really, the focus that I have, it's sort of like the difference for me, the difference between therapy and coaching, right? When you're really not functioning, therapy brings you up to baseline. But when you're sort of at baseline and you really want to take off, that's where coaching comes in. The wellness journey for me is much more of a focus on, okay, you're here. How do we raise you up? And by raising you up, everybody else kind of comes up with you.
Yeah. Actually, the more I'm looking into this for my own practice, the more, because we're working on patient satisfaction right now.
Mm-hmm.
And so we're deciding how we're going to roll that out in the practice. And what we're doing is, or at least what we're talking about doing, is doing that more in a highlighting the positives rather than focusing on the negatives. We definitely want to address the negatives in terms of any outliers and anything that really needs attention, as you were saying, that that one outlier who's really having a tough time, and you really want to look after your colleagues in that situation, but using these shining stars as the example for and allowing that rising tide to lift all the boats.
Yeah. And listen, doctors want to be heard. They want to know that you not going to be able to change everything. but they want to know that their issues are being heard. So have you heard of what a GROSS initiative is?
No.
GROSS, it's like the AMA initiative. It's called Getting Rid of Stupid Stuff. So what we recently did is we surveyed all the doctors and asked them the one question, what's one thing? Give me like the top thing that if we could change would make your day better.
Yeah.
And we got this huge long list of things, and then then you categorize them into easy fixes, things that can't be changed, that you just need to deal with, or things that need a project and we're going to address. And we sort of did it, and some of them were so easy to fix, and it was 1, 2, 3, and that's so rewarding. And then some were like, okay, I hear you, this is stressful, but we can't. The EMR is the EMR. Like, I can't change that. It exists. Yeah. And then there were several projects that we took on, and then giving that feedback to them, like, thank you so much. And they're part of the process. That's kind of like an operational wellness initiative.
Yeah.
To speak to you think like, what does a wellness officer do? It could be coaching and therapy. It could be leadership development. It could be operations. It could be so many things.
That's funny. I was about to ask you as a closer, if you're going to be a wellness officer, what's one thing that you could do at your practice tomorrow? And it seems like that GROSS survey is a great way to start, because then it proves to the practice that we can make changes. We can make changes, and this role, this officer can make our lives better.
And that you matter, right?
Yes.
Yep.
Yes. That's another thing also, that I try to do with my practice is make sure that the staff has a voice and when they have ideas, there's a route for it to take to get to the leadership. Because there are some terrible ideas, but there are some great ideas out there that can really change the practice and feeling like they matter. Yeah, I love it. I love it.
Develop your people, look, that's my best advice, is do what you can to develop your people, and they will grow your company.
Well, if people want to find you and they want to listen to Reinventing the White Coat, where do they find you?
So I'm easy to find on LinkedIn, probably is the easiest place, or my website, shaercoaching.com. You can link to my podcasts straight from there. It's on Master Clinician's website and on Spotify.
And just for the listeners, Shaer is SHAER.
Correct.
Coaching.com. Yeah.
Yes. And listen, anybody who wants to get into this line of business, please, we need more people in this line of business. Reach out. I'm happy to chat.
We do. Well, thank you for your time, and thank you for all you do for physicians.
Thank you.
Thanks for listening. So please share it, or like it, or comment on a social media post, or write us a 5-star review. Thank us again for listening to The Physician's Guide to Doctoring.